Welcome everyone. Welcome to this special webinar from USMLESarthi. I did want to introduce Dr. Shreya Deoghare, and we have a very special, important announcement to make. As you probably know, she's been doing a great job with the research initiative, and now Shreya's team and we have decided to collaborate. So a bit more about that collaboration, but Shreya, welcome. And why
Thank you,
don't you
Pawan.
introduce yourself? So then we'll get started.
So good evening, everyone. I am Dr. Shreya Deoghare. I am a dermatologist practicing here in India, and I am the founder and CEO of the Good Research Project. If you have not heard about it, the Good Research Project was started by me a year ago. And my aim was to promote, very genuine and research work, and it should be very practically oriented, not something like lectures and giving certificates. I just wanted something which students can understand, so I made it in a very easy to understand format. And over this 1 year, it has been going really great. Like in last 6 months, almost 8 to 10 research groups are being organized every month, and each group has nearly 5 to 6 students. So many more and more people are joining, mostly because of few very good things which is catching everyone's attention. One is that it is completely virtual, everything is virtual. Secondly, we use the very freely available data sets which are there online. So we don't need ethics committee approval as well, which obviously shortens the process of research. Thirdly, the turnover time is very fast. That is, we are able to complete the research within 2 or 3 weeks, and then we submit it for publication. So these are the few very catch points. And yes, it was the most affordable one out of everything that was out there. So I wanted to do something for the students from India, because everyone approached me saying that you have so much research experience, so why don't you teach us? So I created something which was really affordable, it could be completed in a very short time and very easy to understand as well.
Yeah, so this is great, and to all the students, she's now collaborating with us. So the Good Research Project.
Yeah.
So for those of you looking for a link or how to join, Swati and Aarti from our team will send the link here. And I think the next project is starting July 5th, correct?
Yes, that's right.
So we are very excited. The other good thing which she didn't mention is it is very affordable. Number one, and this is one of also the aims from USMLESarthi to make USMLE journey as affordable as possible for others. So this is a very good initiative that Shreya has done, very affordable research. And also, whether you are in your med school, first year, second year, research has become a lot more important, whether it's your USMLE journey or otherwise. So even if you are in second year of research or second year of MBBS, you will find it much more easier to do with a step-by-step guidance that Shreya is going to provide. So that, and also, I know Shreya, you started it while helping the Indian students. So Sarthi is a global organization. So we hope that students from other countries also can, take advantage of this research. So we are very excited, to bring this offering to our students, make it affordable, and help them in their USMLE journey. And to all of you who are asking questions on chat, Aarti and Swati are going to answer, and we will take time after this also to answer questions. So, let's get started, Shreya, because we've already gotten a lot of questions. So why don't you talk to us about different types of research? Students are always confused. What is a manuscript? What is a case report? Letter to editor. So can you help us understand different types of research?
Yeah, sure. So just one thing, my first course, which is there on the Good Research Project, is Introduction to Research and Publication. And in that, I have basically explained everything what a student needs to know. It is not a very lengthy course, with lots of materials and texts and transcripts. It's just a 1 hour session about what exactly a student has to go through when he is aiming at research and publication. So, article is a separate thing, a manuscript is a different thing. So, let me first explain you this because this is very confusing for many students. So, an article can be of different types. So, the easiest one, and everyone knows, is a case report. Okay, and after that comes the case series. So, like students usually come to me with a case report that can I publish this? Let's say anything about hypertension. Okay. So a case about hypertension is going to be published only when it has something unique in it. Okay, so something unique means that you have given a different kind of treatment, or was there a different kind of adverse drug reaction to that treatment? If it is something which is already mentioned in the literature and widely known to everyone, it won't get published. Okay, because the aim of the journals is to add something new to the literature. Okay, so this is what students need to really understand, that your case report will be published only when something unique is there in the case. Okay, or even the rare case reports are also published. So a case report is basically when you explain about a single patient, either you are describing the symptoms which are different from what has been already published in literature, or it is some new treatment or some new investigation findings or some new drug reactions, adverse drug reactions that the patient is getting. So this is basically a case report. When 3 or 5 or more cases are combined together with a common and a similar finding, it is known as case series. This is the second type of article. After that, there is an original article. An original article is basically a research work. Okay, it can be an observational study or an analytical study. So this classification has been beautifully explained in the community medicine textbooks, which is there for both second and third year MBBS students. So you can just go through it. So, all the observational studies like the cross-sectional studies which are there, or the ecological studies, or the analytical studies, which includes comparative studies, case control studies, cohort studies. So all these come and form the original article. So original article can be of many types, and in methodology you have to mention which type of research have you exactly done. Okay, after that comes the review article. So when I started my research journey in the first year of MBBS, when I was selected for ICMR project, that is the Indian Council of Medical Research short-term studentship program, the first thing that I asked my guide was, am I going to invent something new? Are we going to come up with a new treatment? So this is what everyone has in their mind about research, right? Are we doing something new? Is there some new treatment that we are going to give to patients? So she said, no. Research is basically research, searching for something which is different, but is already known in the literature. Okay, so in the similar way, a review article is review. We are reviewing the articles which are already published. Okay, so suppose there are 10 original articles and 20 case reports about a new condition. Let's say sarcoidosis. Sarcoidosis is something which is very difficult for students to understand. And if you are, suppose, you go through all the articles which are already available on the PubMed or other, sites about sarcoidosis, you read all of them, uh, understand what are the important conclusions of all of them, and compile it together and write it. It is known as a review article. Okay, so review article is basically a narrative review article, which is basically our textbooks can be said to be an example of a narrative review article because they have long list of citations at the end. And a systematic review article is one where you are comparing the statistical findings of all the articles and coming to a very strong conclusion out of it. And then comes the meta-analysis, which is again above the systematic review and the narrative review articles, wherein these two things are also reviewed. So these are the very broad, different types of articles which are there. And other than this, in many journals, there are like you can put short articles like letter to editor or your viewpoint on something which is, very upcoming and let's say very much in news. Let's say for nowadays, it's all about the artificial intelligence and chat GPT and everything. So one is letter to editor or viewpoint. Another thing can be images. You can put up some images like in dermatology. We do put up lots of images. In cardiology, you can put up, let's say, some ECG findings which are there. Or in radiology, you can put up some interesting, images from USG or X-rays or something like that. And there is even things like, let's say, residence page and many more things which are there. Short communication, brief communication. So all of these are articles. Okay, the manuscript is one which does have an article, but it also has things like cover letter. When you are submitting an article to a journal, you have to modify the article. It should have a cover letter which addresses to the journal saying that, okay, dear editor, we are submitting this article with a title to your journal. And after that, it should have information about all the authors, information about your main article, like the word count, the abstract, and everything. So abstract is basically a summary of your article. So these are three different things: the article, the manuscript, and the abstract. And it's very confusing for students, but I think it's clear now.
Yes. So, and just to clarify to our audience, your course A and B, all of them will go over these details, and in course
Yes,
B,
exactly.
you will actually help them write
Hmm.
it and publish it, right? And
Right,
Aarti
yes.
and Swati, maybe you can put links to the enrollment since we are starting 5th of July. So thank you. Now, the next question which we always get is, I want to publish in PubMed, or students are
Mhm.
confused about the various indices. What is an index, PubMed, Scopus,
Yes.
versus what is a journal which is in PubMed index? So can you talk a bit about the index and the journal?
So indexing is, it's a title, let's say I'll just say which are the indexes. So one is a PubMed index, another is Scopus, then is Web of Science, there is Index Copernicus, and there are many more. So these four are the most famous ones. So let's take an example. Suppose you are in a class and you and your friend, um, okay, you have a different subjects like say English, like say maths or something like that. So the teacher divides you into different groups, right? And when the teacher divides you into different groups, let's say on the basis of marks, okay. So excellent group, very good group, good group. Okay, so these are the three groups. Let's compare it with the indexation, the PubMed, Scopus, and Web of Science. So the English teacher has divided these students in these three groups, where excellent, very good, and good. But the maths teacher does not feel that. She feels that only few students of the very good group, the excellent group, are in fact excellent, and other are only good. So she will take these students out and she will put it into only the good group. So basically, indexation is something which is, it has been devised by different countries and different agencies and organizations, depending on what they feel about the journal. It's not just a feel, it's a very big calculator based on citations and everything. So it is possible that if the English teacher feels that you are excellent, the maths teacher might feel that you are, only good. Okay. So in the similar way, the way America or the USA sees PubMed, maybe some other European country does they have like Web of Science or the Scopus is placed on a higher level for them. So it's basically just an index or the quality which is assigned to that journal. Okay, so you need to be very clear. There are many good journals which are not indexed in PubMed but are indexed in Scopus and Web of Science, have very high impact factor compared to the PubMed index journals. So these are equally good. The only reason why we keep hearing about PubMed is because it is more recognized in USA. Okay, but that does not mean that the other journals are, not good enough for publications, or, it will bring down your reputation or something. It's not like that. All the research which is done holds value.
Okay, and then about the impact factor of a journal. That's the other question. What is it?
Yes. So impact factor is something like it grades the journal, the journals with high citation index, or high number of citations, or something like which has constantly published very good articles, are placed at a higher level. It is comparative to the marks that a student gets. Okay, some will get 98%, some will get 90%, and some will get 50%. So it is just a gradation. And again, I have students who reach out to me saying that I want to publish in a very, very high impact factor journal. So one thing that you must keep in mind is that these are journals usually publish the basic science research where actually something new is being invented. So only something new, a new invention, only that is research, is a wrong concept. Research is a research into the literature. Okay, so there are many more ways in which you can publish. And yeah, that's what I wanted to say.
So now let's switch gears and talk about, the USMLE journey. So the current season, as you know, in 3 months is going to be starting. And a lot of students have coming to us saying, okay, how can I publish in 3 months and such? So talk to us a bit about your course and how students can publish 3 or 4 articles in less than a month or 2 months.
Yes. So one thing is that the student should be really excited, and they should take initiative if they want to work with me. So how you can publish 3+ articles with me is that with USMLESarthi, we have 3 courses. The first is the Introduction to Research and Publication, which is a 1-hour lecture, and you will get a certificate at the end. Okay, so this does not lead to any publication, but it is a beginner level introductory course. So anyone, even if you have zero idea about research, or maybe you are hearing the word research for the first time today, you can join it. This course B, which we have, is a web-based study or observational study, cross-sectional study, or even the epidemiological study, which we will do. So over here, we do not involve patients. We are not going to hospitals to collect data from patients, but we are doing an online survey. It's not a survey, basically. It's a study of the data which is already available online. Okay, for example, like the course which I will be introducing on 15th July, okay, it's an epidemiological study of the mortality of different diseases. Each group will have one specific disease. So there are US databases where they already have information, like based on year, based on, let's say, the states. Okay, about how many deaths are there every year. And there are many, many different parameters for that. So I have designed a study in which it will be very easy to collect data. Like, I will explain it to you how to do that, what you have to enter. The Excel sheet has already been made. So it definitely reduces your efforts. Okay, to collect the data, you just have to do the work and enter the data as I tell you. And after that, it is sent for statistical analysis. Our statistician will, he's usually fast, and within 2 to 3 days, he gives back the data with beautifully made tables and charts. So even the students' work of making charts and tables is reduced. Many students really find it very tedious to do so. So the data collection time is usually 2 to 3 days. The statistician analysis time is again 3 days maximum, or 5 days, let's say. So 1 week gets done over here. And after that, the article writing task is also divided between the students, and it's explained to them how they are going to write the article. So one student will write introduction, another one will write method, the third one will write results, fourth one will write discussion, one will write abstract, another one will write aims, objectives, conclusions, and limitations. So since the work is divided amongst all the students, it's really easy that they have to focus only on one particular part, and they are able to usually finish their work within 3 days or maximum 5 days. The article is edited then for grammar, for plagiarism check and everything, and it is ready for submission by the end of 10 or 14 days. So if you are able to do one article in 15 days, you can even take another course, the same course, and you can do the another article in next 15 days. We usually announce the call for authors every 2 weeks, so that students can join us every 2 weeks with different topics and different research, and they can participate, do the work, get their name as an author also, and submit it for publication. Okay, the third or the research course C, which we have over here, is letter to editor. So when you join this letter to editor course, you will receive a 1 hour video, which will, tell you what to write as an introduction, what to write in the main paragraph, and how are and why are we writing this. Each and everything has been explained in details, even what to be written in introduction. Okay, how to start it, how to end the introduction. Even I have explained that in very detail. Okay, so many students have followed it. Many students have taken this class. Even they have published it single-handedly without the name of any senior author. The writing task will take you hardly 2 to 3 hours, maximum you would say a day, and you can immediately send this article for publication. Okay, so this is something like in this way you can, publish 3 or more articles with us in a month. Okay, one thing is that the time that you are giving is really less. Okay, you hardly have to give 2 hours for collecting data in this web-based cross-sectional study, and maybe hardly 4 or 5 hours more for writing the article, the part which has been allotted to you. So overall, within 5 to 7 hours, plus let's say the time that you require to view the videos, and or the pre-recorded videos or the live sessions, so the combined time that you are investing is around 10 hours, and you are able to publish one research. Okay, you will have your name in that, you are saving your time, and it's really very fast. So I have just made all this based on what the students' requirements are.
Thank you. So for all of you who were asking about fee and all that, I'm just showing the page here. You can actually, Aarti has, I think, or Swati has put the links here. So you can go to this link. It has the description of all the 3, A, B, and C. And of course, then there is a combo. And like Shreya was saying, the good thing is the time and the effort you need is not all that too much. It's not that intense. And in a month, you can actually submit 3 articles for publication. So this is very, very useful and helpful for those of you who are going into the match in a time constrained way now. So you can really get started. So thank you for that, Shreya. This is great. Also, can you talk about a bit about the which themes, topics, and specialties that you're going to start in July? So what kind of topics are there?
So there are, in the broad sense, there are 2 topics. One I've already mentioned. It is an epidemiological study where we will be studying the mortality rates in the USA about specific diseases. The exact topic will be told in the link. And these are based on internal medicine, family medicine, psychiatry, pediatrics, then radiology, OBGY, neurology, cardio, endocrine, and gastro also. And yeah, I think that's pretty much. So all of it, like most of it, and if anyone still has a different request, and if there are 4 students available, let's say for ortho, for example, or dermat, I can definitely make a group and you can join it.
Okay, good. So now let's take some questions that we are getting. And I think you've already answered some of this, but I'll just repeat because I am seeing those. So do these courses lead to publications? And the answer I think is yes.
Yes,
Right?
obviously. Okay,
Okay.
so the thing is, the first beginner level course is the introduction is just an introductory video to make you familiar with the research and publication. The second, the course B and course C will lead to a publication. We are definitely going to submit the articles to the journal.
Okay. And how many journals are these articles submitted to? How long will it take for the journal to publish the research? Is the next question.
Yes. So it is a rule, it is a worldwide rule that you can only submit to one journal at a time, and we are going to follow that. We don't want to be blacklisted. Okay. So we are definitely going to submit it to one journal at a time. Which journal? It is I do not force students to pay for article publication fees. It is totally dependent on the group. Okay, I don't want to force anyone. So most of the times the students decide that they do not want to pay. So they will, I will, make a list of journals where it can be published without article publication fees. But yes, the duration might be longer. That is the peer review process. Another, a good way of publishing in a PubMed index journal is Curious, and everyone knows about it. So, since there are 6 to 8 authors in a group, the cost is usually divided and it certainly reduces a lot. Okay, let's say it's 24K, I think 20 or 24K. So divided by 6 or 8. So the cost per person is divided. I think yes. And the time required for publication is totally dependent on the journal which you submitted. And that is something which is not under my control. And these days, the students are having a doubt that will it get published by September, right? Because you have your application season and everything. There is a column of submitted articles, and you can definitely put your these research articles over there. It shows it shows them that you are interested in research and you have actually worked on it. Okay, so even that holds value, especially if you have no publications till now.
Okay. The next question I can take, are international transactions from Europe available? The answer is yes. Our website should be able to take any currency. Then, of course, there's one question. Is there a review article in the month of July?
As far as today, no, but we can definitely plan for it. Like, let me know your requirements and then I can definitely come up with something.
Yeah, so guys, you can email us and we'll forward it to her, and then we'll collect the number of students interested and follow up with you. For those of you who have concerns that it may be a bit expensive, so the good news is if you take course B, course A is already included for this month, so that's free, and hopefully that'll make it more affordable. Next question. I want to do residency in surgery. So what research should I do? Do we have topics for surgery?
Yes, we do.
Okay. So we do have topics. So that is great. Okay, let me get to other emails. So if you guys are interested in any review article or anything not mentioned, please put your email in the chat box or send us an email, one of the two, right? So either, otherwise there's no way for us to get in touch with you. Either send us an email or just put your email in the chat box.
One thing, Pavan, I would like to add over here, like I've seen many people who are saying that they want to do a review article. It's my personal suggestion to students, especially those who are beginners, you should learn to walk before you learn to run. Okay, review article is really a tough thing to do. So start by basics, start by case reports, start by observational studies. They are much easier to do. And after that, you can definitely switch to review articles. There's no end to this.
Yep. So, I know we are starting one group around July 5th. When is the next group starting? Is it July 15th?
15th, yes.
Okay. And the next question is, would it look bad if one letter to editor has 6 to 7 authors?
No, not at all. So there are few journals which has a limitation to the number of authors. Okay, but there are more journals where there is no limitations. Usually a letter to editor or a viewpoint will have a limitation of 3 to 4 authors only. Okay, you can
Okay.
definitely try to put in names, but that's not going to help.
So are any of our research topics pathology oriented? Someone is considering applying for pathology.
So basically, I was not getting many requests for pathology, but you can definitely consider joining one of them because pathology is a not very clinical oriented as in India, but it might be there in US. So you can definitely join any group. I mean, pathology has all the articles and all the topics which have already been mentioned in for other specialties.
Okay, so thank you for all of you who are giving your emails in the chat. So Aarti and Swati, if you can grab all these emails and maybe later today we can send this email out. How to enroll for this course, Swati, if you can put the link here so that they can join. So there are a lot of questions on enrollment. And so Aarti, I hope you are getting all the emails. Radiology, so there is a question on radiology project. So I think,
Yes.
again, guys, if you send us your email on this chat, we will revert, let me see other questions. So we are getting a lot of emails, so that's good. Let's see if there are other questions. Okay, so looks like there are no other questions for now. So thank you very much, Shreya.
Yeah.
Sorry, go ahead.
Yeah, I'm so sorry to interrupt. So one question that I saw was about the authorship. How is authorship decided? How
Yes.
many authors are there? So everyone who participates gets a chance to be the author. How is authorship decided is based on how excited you are in the group. Are you doing your work on time? Because students join and they do not do their work. So to claim a higher authorship position, you should be doing your work on time and correctly. Okay, the final authorship position will be decided by me since I will be mentoring you in the group. Okay, and yes, that's it.
Okay. Well, thank you very much, Ria, and thank you all. This was great. We will have more webinars like this to help you out, but this was very helpful. Thank you. Hopefully your queries have been answered, and we are grabbing emails from the chat. But any other questions, let us know, and I look forward to seeing you in the course. Thank you and good night, Ria.
Thank you.
Thanks. Bye. Guys, the chat will be open for a few more minutes. If you have more questions, you can just type in and my team will take.